Welcome to the administration of Rectal Diazepam Refresher Module for Wall Residences. My name is Jessa Lane, the Medical Quality Assurance Coordinator, and I'm going to guide you through this refresher module. The purpose of this module is to maintain compliance with DBHDS regulations, have a basic understanding of seizures and the different characteristics of each type of seizure, review the purpose of an individualized seizure protocol and the importance of calling 911 before the administration of rectal diazepam, review the purpose of rectal diazepam and the importance of proper storage and monitoring the expiration date, demonstrate how to respond to a seizure requiring the administration of rectal diazepam. Maintaining certification. According to DBHDS regulations, in order for a medication aid to maintain certification to administer rectal diazepam, a medication aid must 1. Attend a semi-annual or twice-a-year refresher course with module. Successful completion of this video module with successful completion of the accompanying test will suffice as your refresher module. And 2. A medication aid must perform a semi-annual skill competency checkoff by a registered nurse. Medication aids have 30 days after their certification expires to meet recertification requirements. During this 30-day time period, the medication aid cannot administer rectal diazepam. After 60 days, certification lapses and initial training and competency requirements must be repeated. Medication aids are required to complete this refresher course before certification expires or lapses. Seizure information and recognition. The student will be able to demonstrate basic facts about the brain, seizures, and types of seizures. The brain. The brain controls what the body does. It is divided into two parts, right and left hemispheres. The right hemisphere controls the left side of the body, and the left hemisphere controls the right side of the body. The brain sends information to the rest of the body via the central nervous system. Specific parts of the body are controlled by specific parts of the brain. A nerve is made up of small cells called neurons. Neurons send both electrical and chemical messages to each other, which allow us to see, feel, and move. Seizures and epilepsy. Abnormal electrical activity in the brain is the basis of seizures. A seizure is the physical findings or changes in behavior that occur after an episode of abnormal electrical activity. Epilepsy, or a seizure disorder, is a chronic condition that is characterized by spontaneous recurrent seizures. The area of the brain that is affected will cause distinct presentation of a seizure. For example, if the area that controls a specific muscle is affected, that muscle may become motionless or contract and relax uncontrollably. Causes of seizures. Causes for about half of all seizures is still unknown. Some of the known causes are issues encountered during brain development, during brain injury, because of medications, due to fever, poisoning, or diseases of the brain. Seizures may result from acute medical illness or injury and cease once the illness or injury is treated. Types of seizures. Based on the behavior, brain activity, and which part of the brain is affected, seizures are divided into two categories: generalized and partial seizures. Generalized seizures. Generalized seizures are produced by electrical impulses throughout the entire brain. The next few slides will be examples of generalized seizures. Generalized tonic-clonic seizures. Generalized tonic-clonic seizures are characterized by loss of consciousness and falling to the ground if ambulatory. Generalized body stiffening, called tonic, can last 30 to 60 seconds. Violent jerking, called clonic, can last 30 to 60 seconds. The individual may become incontinent of stool and urine. The individual's breathing may slow down or momentarily stop. After the clonic phase, the individual may go into a deep sleep. During a generalized tonic-clonic seizures, injuries and accidents may occur, such as biting the tongue and falls. Absent seizures. Absent seizures are causes of a loss of consciousness for a few moments with no symptoms. The individual, most often a child, typically interrupts an activity and stares blankly. These seizures begin and end abruptly and may occur several times throughout the day. The individual is usually not aware that they are having a seizure, except that they are aware of losing time. Myoclonic seizures. Myoclonic seizures consist of sporadic jerks, usually on both sides of the body. The individual sometimes describes the jerks as electrical shocks. When violent, these seizures may result in dropping or involuntarily throwing objects. Clonic seizures. Clonic seizures are repetitive rhythmic jerks that involve both sides of the body at the same time. Tonic seizures. Tonic seizures are characterized by stiffening of the muscles. Atonic seizures. Atonic seizures consist of a sudden and general loss of muscle tone, particularly in the arms and legs, which often results in a fall. A mild atonic seizure may cause a sudden and brief head drop. During a more severe atonic seizure, the individual may suddenly fall to the ground, lose consciousness briefly, and then get up as if nothing happened. A helmet is usually worn to prevent injury to the head or face. Partial seizures. Partial seizures are produced by electrical impulses in a small part of the brain. The next few slides will be examples of partial seizures. Simple partial seizures. Simple partial seizures manifestations are dependent on the area affected and tend to be localized. The individual may or may not lose consciousness and may be aware of the seizure. Manifestations include simple motor, simple sensory, and simple psychological. Complex partial seizures. Complex partial seizures are the most common type of seizures. These seizures often begin with an aura or warning that the seizure is about to occur. Most commonly, this aura is described as a feeling in the pit of the individual's stomach that rises up to the throat. Often this sensation is accompanied by an odd or unpleasant odors or tastes. After the aura, the individual may suddenly become limp or stiff, appear dazed, confused, and apathetic. Automatisms, or involuntary but coordinated movements that are purposeless and repetitive, may occur. The most obvious behaviors may be lip smacking, repeating words, chewing, drooling, swallowing, falls, and sleep. Complex partial seizures may spread and become generalized. Consciousness is always impaired. Partial seizure with secondary generalization. Partial seizures with secondary generalizations begin as focal seizures and evolve into generalized convulsive seizures. Most people with partial seizures have simple partial, complex partial, and secondarily generalized seizures. In about 2/3 of people with partial epilepsy, seizures can be controlled with medications. Partial seizures that cannot be treated with drugs are often treated surgically.
Cluster seizures. Cluster seizures are also known as acute repetitive seizures, and they're identified as a marked increase in an individual's normal seizure activity. If an individual's seizure protocol requires staff to administer rectal diazepam for cluster seizures, the staff must be able to distinguish the difference between normal seizure activity and cluster seizure activity. Cluster seizures will vary from person to person. Cluster or acute repetitive seizures are when 2 or more seizures occur over a brief period of time and the seizure activity is not typical for the individual. With cluster seizures, the individual recovers or regains consciousness between each seizure. Status epilepticus. Prolonged or clustered seizures sometimes develop into non-stop seizures that's called status epilepticus. Status epilepticus is a series of seizures with each successive one occurring before the individual has fully regained consciousness or that lasts more than 5 minutes. Status epilepticus is a medical emergency that requires emergency medication and hospital treatment to bring the seizure under control.
Individualized Seizure Protocol, the Purpose and Implementation. A seizure protocol is developed by the individual's service team, and the individual's prescriber. It is usually in the form of a written order and describes what staff need to do to respond to an individual's seizure. It is tailored to the individual and will include instructions to administer diazepam rectally for seizures lasting a defined period of time. Seizure protocols would need to address, at minimum, 3 key components. 1. Events or mannerisms that precipitate the onset of seizures for the individual. 2. The characteristics of the individual seizure. And 3. Guidelines for rectal diazepam administration and initiation of emergency response systems.
Infection control, hand hygiene, and glove use. Hand hygiene is an important component of any care, particularly with the administration of medications. Hand hygiene includes the use of soap and water or alcohol-based hand sanitizer gel. Glove use. Disposable gloves are worn when it is reasonably anticipated that contact with bodily fluids will occur. Gloves should always be worn when administering rectal diastat. Gloves are single-use only, and remove gloves in such a manner that prevents contamination of clothing and skin and discard into the trash. Rectal diazepam gel. Information, side effects, and administration. Rectal diazepam is a benzodiazepine. The medication is a gel that is usually supplied in a pre-filled delivery system, such as a single-dose syringe. The syringes are generally dialed and locked to the prescribed dose. Examples of rectal diazepam manufacturers include Teva's and Diastat. The most common side effect of rectal diazepam is sleepiness. Rectal diazepam may cause breathing to slow, but this is a rare side effect. Stay with the individual who has received rectal diazepam and monitor their respirations. An ideal respiratory rate is 12 to 20 breaths per minute. If a person who has received rectal diazepam stops breathing, start CPR immediately and call 911. You'll need to document respirations on the Diastat post-administration monitoring form. As soon as you receive the medication from the pharmacy, you need to do the following. Review the storage requirements on the package insert. Inspect the administration syringes for cracks, breaks, leaks. Review the dose in the display window and confirm that it's consistent with physician orders as well as the individual's seizure protocol. Read the packing to check the expiration date and store the medication in accordance with Wall Residence's policy for controlled substances. This means that Diastat, or rectal diazepam, must be double-locked. DBHDS has required that all agencies comply with the system to monitor the following with respect to rectal diazepam. 1. The correct amount of medication is available. 2. That the medication is stored correctly and in accordance with manufacturer's specifications and the agency's protocol for controlled substances. 3. The medication is handled in accordance with controlled substance policy in the facility. 4. The condition of the syringe. And 5. The expiration date of the medication. Wall Residences has developed a Diastat protocol. This protocol will be kept within the service for easy reference, and it complies with the outlined regulations mentioned on the previous slide from DBHDS's curriculum. If you need access to this policy, please contact your program manager or myself. Administration of rectal diazepam. Before administration, only administer rectal diazepam if you know an individual's protocol, particularly the time to administer the medication from the onset of the seizure and the proper dose. Please call 911 before the administration of rectal diazepam. If you need step-by-step instructions for the administration of rectal diazepam, please contact your program manager, the information leaflet, or myself. The next few slides will briefly review proper administration. Make sure the person is on their side. Get the rectal diazepam kit, including lubricating jelly, and put on gloves. Grab the syringe from the kit. Push up with the thumb and pull to remove the cap from the syringe. It is very important to make sure that the seal pin is removed from the cap. Lubricate the rectal tip of the syringe with the lubricating jelly. Turn the person on his side. Bend the upper leg forward and expose the rectum. Separate the buttocks to expose the rectum. You will gently insert the tip of the syringe into the rectum. The rim of the syringe should be snug against the rectal opening. Slowly count to 3 while gently pushing the plunger until it stops. Count to 3 before removing the syringe from the rectum. Count to 3 while holding the buttocks together to prevent leakage. Seizure response with rectal diazepam. Responding to a seizure requires protecting the individual from injury, timing and observing the seizure, administering rectal diazepam when indicated, calling 911, and remaining with the individual until EMS arrive. Staff responding should remain calm, create the safest possible environment for the individual at the start of the seizure. If the individual is sitting or standing, gently lower the individual to the ground to avoid a fall. Clear the area of anything that could hurt the individual. Do not attempt to restrain the individual or use force of any kind. Place the individual on his or her side. If possible, put something flat and soft under the person's head. This positioning prevents the tongue from blocking the airway and prevents the individual from choking on secretions. Do not place anything in the individual's mouth. Padded tongue blades or airways are not accepted because they may induce vomiting, cause potential damage to teeth, and may be aspirated. Loosen tight clothing, especially around the individual's neck. Do not give the individual any oral medications, foods, or drink during the seizure. If the administration of rectal diazepam is indicated, call 911 or have another staff member call 911, then get your medication and follow the administration steps. Stay with the individual until the ambulance and EMS arrive. If the individual stops breathing, immediately start performing CPR. Complete the seizure documentation that Wall Residences requires. Congratulations, you've completed the Diastat Administration Refresher Module for Wall Residences. Your next steps include taking the test located below this video and hitting Submit when done. You'll need to perform the skill competency checkoff with a registered nurse before your certification expires. You'll need to send the competency checkoff to Michelle Morris at the Wall Residences main office. If you have any other questions or concerns, feel free to contact your program manager or myself for additional information. Again, thank you so much for your time, and I appreciate your patience. I hope you have a wonderful day. Thank you.